7 in depth tonight. Henry Ford Health System feeling the pinch of the pandemic staffing shortage.
As a result, it is eliminating more than 100 hospital beds at a time when they are desperately needed. The move comes despite 98% of the Henry Ford staff being vaccinated against COVID-19. The mandate target was last Friday for employees to avoid suspension.
7 Action News reporter Peter Maxwell tells us why the system is now cutting beds.
Largely due to staffing shortages that are happening across the nation and right here to healthcare systems in Metro Detroit. Henry Ford Health System eliminating 7% or 120 hospital beds from its 5 hospitals in Detroit and Jackson. Most beds eliminated were general medicine beds, but also ICU beds were eliminated too. And with signs of a fourth surge coming, it's a major blow to the hospital system as hospitalizations continue to rise because of the COVID-19 Delta variant.
We are flexing our bed capacity to maintain our full spectrum of services across our health system. We also urge patients not to delay any emergent or critical medical situation.
Hospitalizations are up 15% from COVID-19 in the last 2 weeks. At Henry Ford, 129 patients are currently hospitalized across their 5 hospitals. 79% of their COVID cases are of the unvaccinated. 11% are those in between the first and second dose, and 10% of those are fully vaccinated. And due to the newest COVID-19 rise in cases, the hospital is at 95% capacity for COVID and non-COVID related cases. Dr. Aidan Makara says it's also putting a strain on their ERs and wait times.
The emergency department have been very busy, as well as our hospitals.
Over at the University of Michigan, their health system is also taking 13 beds offline until the end of the week due to staffing shortages. In a Vivian Healthcare study released in April of this year, it shows that nurses are leaving or have considered leaving the profession because of a decline in morale, increased stress, and low pay. And Beaumont Health Systems has in the past adjusted services and bed capacity when they were dealing with staffing shortages. And at times they have closed up to, quote, 130 inpatient beds at various times due to staffing. Now, we also reached out to several other hospitals within Metro Detroit for comment. They did not get back to us in time for broadcast. Reporting in Detroit, I'm Peter Maxwell, 7 Action News.